When the doctors told me if you continue in a certain way, you're going to have diabetes or type 2 diabetes, that's a scary thing. It really impacts you. You feel like the world's on your shoulders. My name is James Doppler. I'm 32 years old. I'm head chef in a restaurant here in Berlin. I was born in Vienna. My father died when I was 3 years old. My grandfather was a butcher, and he was like my father figure growing up, and I tried to lead my life by his examples. I wasn't very academic. I always loved food and being around food, so at a young age I decided that I wanted to go into catering college. I got married 2 years ago, slowly settling into family life or thinking about having kids. One of the biggest problems of chefs is grazing at work. And so I've put on a bit more weight. In our industry, you're under a lot of pressure and you're pushing all day. Therefore, I don't sleep very well. I sometimes sleep 2 hours a night, and that then for 2-3 weeks. Health-wise, you just notice it. Your whole body is telling you it's not healthy what you're doing, and now we have to change.
Type 2 diabetes are really increasing in number worldwide. That's because of bad lifestyle. It's because of obesity, of lack of exercise, of stress. My name is Diego Schmidt. I'm a physician here in Berlin, Germany, and my focus is on diabetes care and metabolic syndrome. My passion is to help my patients with innovative technology, innovative tests, and innovative intervention. What we usually do in medicine is we focus on symptoms, and so we use a lot of pharmaceutical interventions to treat the symptoms. What I found out that there's another approach, looking at the root causes of the problem and not asking what, but more asking why. And what really helps to do that is technology. The Accu-Chek View is a good example of how collecting data empowers the patient on one side, and it helps me as a physician to monitor what is going on. When I usually see patients, I try to make a specific strategy and plan to help them fulfill their goals. James, he's really open-minded and willing to change his life and make progress.
My biggest issue was that I started off with this and I wasn't losing any weight. Then I tried different diets and all didn't work to a point where I actually put on weight.
Coming back after some months, James, he didn't make any progress. Of course, I was wondering, is he really following the diet advice? What is he doing in terms of exercise? We needed tools to help him to track his progress. We gave him a scale to measure his weight, we gave him a Fitbit, we gave him a blood sugar device to feed some health data into Roche Accu-Chek View, where I can use it to give him advice on interventions, where he can use it to stay motivated and monitor his progress.
On my phone I have the Accu-Chek View. For me it's time-saving. Because of my busy schedule, I can't go to the doctor once a week. If there's certain things that I can do every day at home, I think it's a great thing.
If you look at the Accu-Chek View dashboard, it has an alert function. And if I feel I have to do an intervention, I can send the patient a digital message. So we have an interactive coaching tool, and this is perfect.
The data that is shown on the app, I will be able to see the changes. If you see the evidence, you can control the direction it's going to move in.
Using all the technology and tools I have, collecting data with wearables, really supports my coaching idea.
Dr. Schmidt is really helping to change my lifestyle. I want to be a healthy father, I want to be a healthy husband, because I want my kids to grow up and know me, and I want to lead by example also. I think it's going to be life-changing. It's just amazing.